Hello, I'm Dr. Sandeep Jha. I am a liver DG specialist and liver transplant surgeon, and today we will talk about recovery after liver transplant. What is life like after a liver transplant? So, liver transplant, which is a very significant event or major event, happens in someone's life, and it is natural that there must be many questions answered in his mind that how will my recovery be after the transplant? The immediate post-transplant period can be tough, but over time, life finds balance. Let's break it down into phases. Initial recovery, up to 3 months, up to a year, and beyond. We divide the post-transplant period to understand it in different periods, such as immediately after transplant. If you talk about 1 month immediately after transplant, then it is a very intense phase and a difficult phase. After that, you talk for up to 3 months, then we will talk for up to 1 year, and after that, we will talk about how life lives beyond 1 year. So the period immediately after liver transplant is a very intensive period, which is the patient or stay in a hospital. He is admitted to the hospital for about 2 to 3 weeks, and a lot of medicines are used, and the risk that occurs in this period is quite high. Risk of infection, risk of complication, but when the patient is being discharged around during the second or third week, when the patient is discharged, he is able to walk by himself, eat by himself, and to a large extent he is able to take care of himself. After the discharge, they tell you to stay around the hospital so that it is convenient for you to be able to check up the hospital law 2 or 3 times a week so that we can monitor the situation closely. So that's how there is a month after the transplant. He's very intensive and the medications are also going well. Apart from immune operation, you get antibiotics, some painkillers, some antiseptics, some health supplements, and many other medicines that work. If it is continuous with you, then the first month is a little difficult. Why is the recovery point off? After that, you are discharged. You follow up from your residence or hotel intensively with you. From 1 to 3 months, patients experience physical recovery, improved muscle strength, appetite, and overall health. During this time, medicines and clinic visits gradually decrease in frequency. There are complications of transplants. They present until the first month. If there is a complication after that, the risk of complication is reduced to a great extent, and this is the time when we advise the patient that you should return to your own. You can travel back to your home country or home country. After this, the phase that comes is a phase of 1 month to 3 months, in which the patient does his test weekly and follows up with us, and if there is any problem, he puts it in front of us. Even at this time, a lot of medicines are going on to the patient because it happens that the liver just fits in the first month inside the body, and after that, once the liver fits in the body, then slowly builds up the body. Does that mean the muscles come back? Muscle gains meat, strength comes, the body feels hungry to eat, the patient has more of all this, changes come in the body, and gradually the new liver builds up that body because already the body becomes quite weak. When cirrhosis persists, the patient loses all his muscles, the body becomes swollen, edema becomes weak. It takes the liver about 2 to 3 months to replenish all this. So that's what happens. It is less intense than before, but still has to follow up quite regularly. When the 3-month landmark is crossed once a month, then the complications or risk of the patient is reduced to a great extent, and this is the time. When a lot of medicines are also reduced, then you will see that after 3 months, the medicines of the patient, which is about 10-15 medicines, are reduced to about 2 to 3 medicines, which you have to take regularly and follow too. The period that occurs is reduced, meaning if in the 2nd and 3rd months we were telling them to get tested every week, then after 3 months we say that you can get tested twice a month, or in many cases even once a month, and send the purchase, then there is no problem, because by that time the liver is set and the strength muscle mass of the patient is recovered considerably. So after this period of 3 months, one gets to see the actual benefit which one gets to the body after liver transplant, and we say that which is complete recovery. She sees a complete recovery in 2 to 3 months, and the patient starts looking like her normal self again. So this 3-month period is very crucial. Thereafter, the patient's medications are greatly reduced. They take 2 to 3 medications that last for a year. And the period of the whole year is a disrespectfully important period, because if a patient is fine for 1 year after transplant and there are no complications, then the risk of future complications is reduced to a great extent. And after 1 year, the usual patient stays on 1 or 2 medicines, and we tell them that you should get tested once in a month or two and show it to us. And if there is any problem, then contact us. Then after 1 year, the patient's life becomes almost normal. And the medicines that are given are exactly like the medicines that are given to a sugar patient or a diabetes patient or a blood pressure patient. The same medicines are given in the morning and evening, and they are called for follow-up once in a month or once in 2 months. So this is the significance of recovery. And as far as joining a professional or starting work, after 2 to 3 months, the patient becomes fully capable that he can do all his work by himself. You can join your office. If he can do his routine work, then this is a very important stage of 3 months in which he can join his job back. And there are many of our transparent patients. So they are in very active job profiles, like there are businessmen, there are police officers, there are army officers, and there are sports persons. So there are a lot of people who can go back to their everyday lives about 2 to 3 months after the transplant, when he recovers completely. And after that, we say that the patient should take care of some things, which is mostly that you should follow up regularly, get your tests done from time to time. This is a regular follow-up because point number 1. Second, you need to eat healthy food, and you need to do some regular exercise to keep your body fit. Third, and what is very important, is to stay away from alcohol at all, or to keep any risk factor under control, as if it became obese, diabetes has become, hepatitis B has become, hepatitis C has become, all these have to be controlled. The fourth point is to protect yourself from infection. This means that transplant patients have a higher risk of infection. So you have to protect yourself from the infection. Do not eat dirty food or do not come in contact with an infected patient. Then you have to follow the guidelines. And the fifth point is that your medicines are ahead of time. There's a fixed time for taking immune separation drugs that you have to follow so that your body's rejection rate decreases. So 5 important points that any patient has to follow is to eat well and exercise. Follow up regularly, Stay away from alcohol or any other risk factors. Protect yourself from infection and take your medicines on time. So if the patient follows all these things, then his recovery is good. And after the transfer, they can live a very fulfilling life and be successful in their personal and professional life. So if you think this video has important information that has benefited you, so please share, like, and subscribe to this channel so that this information reaches more people. Thank you.